Hello candidates, welcome to my YouTube channel E2L OET and IELTS. Also, heartily I welcome you to be part of my Facebook page E2L OET and IELTS. In our last video we have discussed about different type of introductions, and I had informed you that on today's class we'll discuss about vocabulary. So on our today's class we'll discuss about what kind of vocabulary we have to use for our OET writing and how we need to use our vocabulary into our letter. Most important is that you have to understand before you are writing those vocabulary into your letter. If you don't know what does it mean, what vocabulary it's mean, or whether that vocabulary is suitable according to your sentence structure, therefore you no need to implement those vocabulary into your letter. If you are 100% sure, then you can write down those vocabulary into your letter. So before proceeding with our vocabularies, if you didn't subscribe our channel, then please do subscribe, like and share. So we'll start with vocabularies. About purpose. About purpose, there are three vocabularies are there: requires, needs and seeks. These three vocabulary mainly we use into our introduction paragraph of OET writing. Now we have to understand that when we have to use this word. First word, requires. Mr. X requires yours. So here you need to understand that requires when you have to use this vocabulary and how you need to improve clarity into your letter. So here we'll start with Mr. X requires your continued care and management. So that time you can say Mr. X requires, or you could say that Mr. X requires your comprehensive care from your service. There also you can use requires word. Second, we can go with needs. Needs you can use when patient needs something about guidelines, about instruction, or his suture has to be removed. So in those kind of case you can go with Mr. X needs. Okay. Now we'll just go with example so it may clear you about how to use needs word. Mr. X needs your guidelines about dietary regime. Mr. X needs your follow-up care for his speedy recovery. Mr. X needs your assessment to improve his condition. So this is what we learned about needs. Third vocabulary, it is about seeks. Seeks vocabulary you have to be more careful that when you have to use. Seeks means something emergency or for immediate purpose. So if you are writing a letter for emergency purpose, that time you can go with seeks. For example, Mr. X seeks your immediate assessment for his betterment. Mr. X seeks your urgent assessment and management for his convalescent. So therefore you can use seeks word. So in my opinion, if you are going for emergency purpose, that time you please follow the thank you for seeing introductions. So that time your sentence will bring more clarity into your letter. So what sentence will be? Thank you for seeing Mr. X, who seeks your urgent assessment and management from your service for his betterment. Now we'll move with treatment. Treatment, as you know, you all people are from medical, so you know when you have to use this word. So for your better clarification, I explain you then how you have to use, and according to the situation, according to scenario, what vocabulary is best suitable to your letter. We'll start with comments done. As comments done, everyone commonly using this word. Comments done means something we have started and going on. If you are writing that patient was comments done, it means that something you started previously and it was there till yesterday and by today morning, but yet not sure about future. So therefore if you want you can continue the sentence as well. So we'll just go with example. Mr. X was commenced on 2 tablets of tramadol for pain relief, which needs to be continued post discharge. So that will be your sentence. In addition, you can go with Mr. X is commenced on 2 tablets of tramadol for pain relief. So this sentence will describe as you have started this medicine today and patient need to continue for future as well. Next one, commenced on we can use for physiotherapy session, occupational therapy and hydrotherapy session as well. So therefore you can go with Mr. X was commenced on physiotherapy session to improve his mobility. Alright, so now we'll just move with the second vocabulary, that is treated with. Treated with we use for the short durations. For example, Mr. X was treated with intravenous antibiotic for 5 days. So here you describe for that particular course. So that time you can go with the treated with. Next one, managed with. Managed with means some of the situation or some of the symptoms you are managing for that particular moment. So that time you can go with managed with. For example, pain was managed with analgesic medication. Another example we can go, swelling was managed with ice pack. So manage with you have to use for that particular symptoms which you are managing for that particular moment. So that time you can go with manage with. Next vocabulary is controlled by. Controlled by means some of the symptoms you are controlling by particular medication or particular plans. So that time you can go with controlled by. For example, we can go with high blood pressure and diabetes were controlled by antihypertensive and diabetic medication during hospitalization. Sorry for mistake, here it is written as a was controlled. Sorry for that, it is not was controlled, it is were controlled by. Alright, yeah. So we'll start again. High blood pressure and diabetes were controlled by antihypertensive and diabetic medication during hospitalization. So this is the third word what we learn. Next one, immunized or vaccinated. Either we can use immunized or we can use with vaccinated. So that sentence will be he was immunized during nursing intervention, or he has to be immunized for measles. So he has to be immunized for measles, that you are describing for the future sentence. Now we can go with transfused. Next vocabulary, transfused. Transfused obviously you have to use for blood, platelet. So in that case you can go with transfused. 3 units of packed blood cells were transfused, or you can say that platelet were transfused during hospitalization. So next word is about administered. Administered vocabulary you can use when you are giving oxygen supplement or you are giving continuation of intravenous fluid. He was administered with intravenous fluid for 24 hours. Oxygen supplements were administered. Administered means for the long durations. Now we are moving with prescribed with. Prescribed with, as that sentence also easy to create. He is prescribed with Panadol for pain relief. So here we have completed vocabulary of treatment. Apart from these, apart from commenced on, treated, managed, you can go with some other vocabulary as well, which you can write down. One is takes. Takes. He takes antihypertensive medicine for hypertension. If you want to describe patient's social history, that time you can go that he takes antihypertensive medicine for hypertension past 10 years. Next vocabulary is about recommended. He is recommended for Panadol for or tramadol for pain relief. He is recommended. Recommended word you can use either for treatment or you can use in case of any radiographical test. For example, he recommended for X-ray, he recommended for MRI, which confirmed his diagnosis. Alright, so here also you can say that he is recommended for diabetic diet or hypertensive diet. Next vocabulary is about follow-up care and appointment. There we'll start with schedule. Mr. X surgeon appointment has been scheduled on next month at outpatient department to remove his suture. So it is about schedule. Schedule means some of you are planning a particular date, or you are appointing the patient particular date, so that time you can go with schedule. Next one, arrange. Arrange, it will be about home visit, or it is about occupational therapies, means something you need to arrange for patient betterment. So here we have written sentences about occupational therapies has been arranged to modify his home setup. So occupational therapy has been arranged to modify his home setup. Also you can say about home visit as well. Next vocabulary is about review. His condition shall need to review by dietitian. Review. Yeah, either you can say about review, consultations, or seen. Also you can say seen by dietitians. Scheduled, appointed, that either you can use scheduled, or you can use has been appointed on the next month at outpatient department to remove his suture. So next vocabulary is about appoint, consult, organization, follow-up care. We will go with another sentence. His condition need to review at psychiatric department, or Mr. X requires psychiatric consultations. You make sure that if you are using any vocabulary, that time you will use proper vocabulary which need according to your sentence structure. That is most important. About sentence structure. There we are discussing about his paragraph, first body paragraph and second body paragraph, as well as recommendation paragraph. Advised, you have to be careful, because many of candidates, they do mistake in spelling of advice. They write ADVICET. It is not CET. If you are writing verb, then you have to write down ADVISET. It is a verb. So in verb form you can make as a advised, or you can say as a advising as well. But ADVICE, it is a noun. In noun you can't do anything. Noun you can't paraphrase. Next vocabulary is suggested, underwent, presented, hospitalized, admitted, initially. Alright, we'll start with advice. Advised. He was advised to avoid heavy lifting for 6 weeks. You people may think that what difference will be there between advised, suggested, instructed, guidelines. Some of vocabulary are not there in this book, but I am repeating, so for your better clarification you may please note down those points into your letter. Advised, suggested, instructed, guided. Advised means you are advising patient to do something at his home for his betterment. In advice there will be no any other option left. Patient need to follow it. So there you have to use the vocabulary that is advised. For example, we can go that Mr. X was advised to avoid heavy lifting for 6 weeks. Next one is Mr. X was suggested to follow dietary guidelines. Suggested means you are providing one option, or you are providing them option which patient need to follow. So here we have wrote the sentences, Mr. X was suggested to follow diet guidelines. It's mean that patient must follow either diet guidelines or exercises or medications. So you are giving them optional that you can follow. We are providing you 3 options, so you can follow either of one option, which will be beneficial for your betterment. Next one is presented to hospital. So here many people get confused when we have to use this sentence, presented. Presented means when patient is presenting to your hospital. Either you could say as a presented, you could say as a visited, and you could also write down as cited, enunciated. There are lots of vocabulary out there which you may use appropriate to your sentence requirement. So presented, Mr. X presented to hospital. It means that patient presented to your hospital without anyone's support. Patient came to your hospital with some of the symptoms, and with their patient is telling you, I have these particular symptoms, therefore you need to provide me treatment. On other hand, you used to write as Mr. X was presented. Mr. X was presented means patient couldn't able to come hospital that time, someone brought him to hospital, and that would happen in few cases, like if the patient is bedridden, patient has any mobility issue, stroke, weakness. So in these cases patient was presented to hospital. So just be careful whether patient is patient presented or patient was presented. Next one, hospitalized or admitted. Hospitalized and admitted. In my suggestion, you write down about hospitalized rather than following admitted. If you are writing admitted, then you have to write down two sentences. Mr. X was admitted to hospital. So therefore you can follow hospitalized. So you no need to mention about hospital. Mr. X was hospitalized following raised of his knee due to fall from stair while climbing up. So this is about hospitalized. About lab investigation, it is shows, reveals, indicated, rule out, evidenced, order, and confirm. Shows you can use when you are writing for X-ray or MRI. X-ray and MRI, no need to get confused. Shows means something they are showing you as a film. So if you are writing about X-ray film, if you are writing about MRI CT scan film, then you can write down as a shows or showed. Next one is about reveals. Reveals you have to write down for that particular report. Like X-ray report, MRI report, or CT scan report. So that time you have to write down as a revealed. Next one is indicated. Indicated you can use only for two scenario. One, if patient underwent for ECG or patient underwent for EEG, because ECG and EEG always indicate you about some of condition. ECG never give you confirmation of condition. They always provide you hint about condition. Next one, rule out. Rule out is defined as to confirm the diagnosis or to eliminate the diagnosis. So just be careful if you are using this vocabulary rule out. Rule out you can use only for biopsy case, bone marrow transplantation, case. So next word is about evidence. So we'll just go with the sentence of rule out. Skin biopsy was performed to rule out his conditions. So you can use rule out vocabulary either for skin biopsy, bone marrow, or for lumbar puncture as well. Next one, evidenced. Evidence you can go for the culture report, blood culture, sputum culture, urine culture, stool culture. So this all culture report always give you evidence of presenting those bacteria. So that time you can go with evidenced. Next one is about order, that you can say that he was ordered for X-ray, he was ordered for MRI or CT scan, he was ordered for blood test. A confirm, as you know, confirm you can use for any of vocabulary. X-ray confirmed his diagnosis, MRI confirmed his diagnosis. Now last is about contrast linking word. This is my personal suggestion to you all people. If you don't know how to use linking word properly or connectives or contrast, then please don't implement into your letter. You may lose major mark. Now we'll start with in spite of, despite of. Linking word and contrast. In spite of, despite of. In spite of or despite of physiotherapy session, his mobility has not improved. If you are using contrast and linking word, then obviously your sentence will call as complex sentence or compound and complex sentence. In our next class, we'll discuss about sentence structure. There are 4 types of sentence structure are there: simple sentence, compound sentence, complex sentence, and compound and complex sentence. Okay, now we'll just move with linking word and contrast. In spite of, despite of physiotherapy session, his mobility has not improved. Therefore, he requires a comprehensive care from your service. So this sentence is called as complex sentence. Now we'll go with another example for even though and for due to which. He is on special diet which instructed by dietitian, even though his weight has gained, due to which he needs your guidelines about exercises. So here we used even though and due to which vocabulary. Now last we are going with however. He was commenced on tramadol for pain relief. However, he still experiences persistent pain. Here if you want, you can connect therefore he need your urgent assessment for his betterment. So these all are the general vocabulary which we need to use for our OET writing. And most important is whether you are following the correct vocabulary or not. That is most important. So make sure that when you will write a good letter, you are following proper vocabulary into your letter. Thank you for watching this video. In our next video, we'll discuss about sentence structure, how you need to write a sentence and what kind of the sentence structure you are following, because that is most important for you to understand. So if you like our video, then please do like, share, subscribe our channel. Thank you.